Good morning and welcome to the 9:30 call. It's great to see everybody. And if you joined us on Thursday for our celebration, whether you were on Zoom or in person, you heard that there was a time where I upgraded our Zoom account uh, live because we had 99 people in the waiting room. No, we had 99 people on the call and two people in the waiting room. And so this morning when I went to log in, Zoom said, you have no upcoming meetings. So I had to extend the Zoom link. So if you had a hard time logging in, that was the challenge. Well, we're working on editing the video from Thursday. We had an incredible kind of watch party in Worcester. We also had watch parties across the state. So we are going to send a follow-up email with a ton of that information, but it was really fun and tricky to be doing a hybrid 9:30 call. We have a lot of lessons learned, as we like to say here at Strategies for Children. This morning we are kicking off our Advocacy Network meet and greet. And I'm going to do a quick, since we have the new website, I'm going to show folks the new Advocacy Network page. And here it is. And I'm going to turn it over to Titus and Jayleese for a word about the Advocacy Network. But you can see this a little bit of a description, where our advocates are from across Massachusetts. So we are in our fourth cohort. So we are grateful for that. We also grateful for the Boston Children's Hospital Collaboration for Community Health, which has been funding this project. And here are our fourth cohort participants. And so this morning we are going to hear from Maribel and Amy, but we have dates for all of the Advocacy Network folks to join us. So I'll put the link in chat. You can see all of our past cohorts there as well. And just one more thanks to Neri Garcia and Tanya Lazar, who helped us with our new website. So Titus and Jayleese, I'll turn things over to you.
Thanks, Amy. Well, I'm excited to kick off Advocacy Network Cohort 4 this morning with Amy and Maribel. And the website is so good. So I put the link in chat.
Titus.
You can read about our current cohort. And then at the bottom where Amy showed you, you can see 40, I think we have 40 plus alumni from the first three cohorts, and each of their names is linked to their blog. So in addition to every advocate coming on the 9:30 call, they also get interviewed for our blog. And the blogs are some of our best blogs of the year. And so I encourage you to check that out. But enough from me. Jayleese, do you want to say anything, any words of encouragement as we kick off?
Of course. I do want people to know that we are going to have a cohort 5 as well. So cohort 4 is here and they're doing an amazing job and amazing work on their advocacy journeys. And in August, we'll have our reception for reflection and then start looking for cohort number 5. So I think people should tune in and see if they're interested because this is a place. 9:30 call is a place to meet the best of the best.
Thanks so much, Jayleese. That may be one of our new merch items. So Amy and Maribel, welcome. So our first question for everybody in the 9:30 call is for each of you to tell us a little bit about you and how you came to be in your current role. And then maybe a reflection or two just as we get started about your work in the Advocacy Network. So Amy, why don't we start with you and then we'll go to Maribel.
Good morning, everyone. My name is Amy Izen. I am a systems thinker, collaborator, and speech language pathologist. I have two primary roles at MGH Chelsea Healthcare Center. Firstly, as the coordinator for the Early Childhood Initiative, which serves young children in Chelsea and Revere. And secondly, as a bilingual speech language pathologist. I started my work at MGH Chelsea full-time as a speech language pathologist, working with young children, mostly between the ages of 2 and 5 years old, and very quickly saw how there are so many interconnected factors that influence children's language and learning outcomes. And I was interested to find out more about those factors and be part of collaboration and leading to implement things that would create less of the same challenges that we were seeing family by family. So that's a little bit about me. I think you also asked to to talk about the Advocacy Network.
And maybe, Amy, a little bit more. So what'd you do before you joined MGH?
So MGH was my first job,
Okay.
actually. Yeah. So in speech pathology, we have clinical placements. So in graduate school, you have usually every semester, it's a 2-year graduate degree and a master's program. And when you're a speech language pathologist in a hospital, you tend to be called doctor. And I always say, I did not go to school long enough to be a doctor, but I say people can call me teachers. Um, but yeah, 2 years master's degree, and you do rotations by semester. And I really liked Chelsea. I wanted to use Spanish professionally and didn't know exactly how. And it was so amazing to work in such a multilingual, multicultural place that celebrated all of that. And as a speech language pathologist, that's like extra fun in the language realm.
Right.
And I really didn't think about working there until the very last day that the leader of the department said, "Oh, we're going to have a position opening. You should think about applying." So I was really grateful and lucky, and did not think I would be here more than 15 years later, but I think it's because I've really been able to grow and follow my interests. And those of you who know Chelsea, you know Chelsea is a very special place. It's 2 square miles, and people love to work together. So I feel really grateful for that.
And tell us a little bit about the Advocacy Network.
Yes. So, I have participated in the 9:30 calls, and I heard about the cohort, and I never thought that I would fit in. It was a lot of early education and care folks, and that's not what I do. But Titus reached out because he and Jaylease wanted to bring in some other perspectives in the early childhood world. And I think specifically they were thinking about the medical sector. And when he described the opportunity, I thought it sounded really interesting because I think of my work across my roles as really being this bridge between medical community resources and early education and care. And I can see how sometimes the sectors are separate, or I could definitely say in the medical sector, there's not a lot of knowledge about the infrastructure of early education and care. And so I'm grateful to be able to bring that perspective to the cohort.
Thanks so much, Amy. Maribel, what about you? Tell us about you.
Good morning, buenos días, ¿cómo están todos? Good morning, my name is Maribel Carvajal. I am an early childhood educator. I ran a family childcare in Belmont, Massachusetts. I am from Quito, Ecuador, and I came to Belmont 24 years ago. And I fell in love with the early education field. I have a bachelor's degree in business, but I came to Belmont, to America, 24 years ago with no English, very basic English. So I came from, I used to work in a bank in Ecuador, but I was always loving the field of education. When I was little, my mom knew I wanted to be a teacher, but in Ecuador, and well, I think in the whole world, teachers are not well paid. So my mom encouraged me to become an administrator and you go business, do something. I know you love math, so you better study. So I have my bachelor's in business. I came to America to look for a better future, and I went to work in a center. I always help children in my church, in the Sunday schools. So it was always my passion. And I land in a preschool center where I fell in love with the children, with the system, with the learning the language through their eyes and through their way of learning. So and I love the fact that I encourage children to play and be children and do every single day, keep up with the curiosity and the loving and caring environment that a family childcare provides. So I am very honored to be part of the Cohort 4. I love the work we are doing. Titus, Julie's, Amy, thank you so much for your encouragement. I love to be part of this amazing group of leaders in Cohort 4 and everybody before that and the ones that are coming. I became aware of Strategies for Children, thanks to Paula and Harold and for their work they have been doing. I met them in 2020 through a little window of Zoom with our group that we meet once a month. I forgot the name now. What's the call? Like
Go Latino.
they no the group that we have with
Oh,
I forgot,
with
with
Marcella.
Marcella. Yes, what's it called? I forgot the name.
It's okay.
Affinity group. That's the word.
Affinity group. All right.
Affinity group. Yes, in Western Mass. So
Oh,
uh,
Harold added to the chat.
I am in Belmont, but I didn't have that connection here. I didn't have a group, and I found this affinity group, and it's been a blessing to meet other women. I feel sad that I can't meet them because they all meet in Springfield and
Right.
Worcester. It's really far from me, but I love to connect with them, and I have learned so much. And I met Paula and Harold with them, and when they became a cohort, I think they were three, if I'm
Yeah,
not
they were
wrong.
cohort 3. Yeah.
They started to share, and then last year they started the Eco Latino, and congratulations for the first year of sharing great information to our community. So when it was the time to sign up, I said I should do it. I should do it. I don't know if I will get in, but I went to apply, and thanks God I
And here
did,
we
and
are.
I yeah.
So for both of you, when you think, what has been most helpful to be part of? So the two of you are joining, how many is it, Titus? 13, lucky 13, 13 members of the advocacy cohort. What has been most helpful for you?
I can start.
Okay.
Love to be part of the advocacy network because it has been enriching experience personally to be aware of the policies as a newcomer. Sometimes every time you don't have the experience of what is the policy making, how how is this insight and how they make the decisions, and sometimes we feel like it's okay, we're just gonna listen, and I feel like it is our time to show up, to speak up, to learn, to be part, to be in the table. So I really appreciate the fact that we are welcoming all all the all the people involved in the field. And like Amy was saying, we wanted another perspective. Welcome and come and let's learn together.
What about you, Amy?
Yeah, well, I like to say, I grew up in Ohio, so the last time that I really thought about government and policy was in my 12th grade government class. And so even though I'm from this country, I think I have done advocacy what I would say is internal to my organization and a little bit in the Chelsea community with the very local government. But to have an opportunity every month to think about policy wider, to think about actually writing policy at the local level or the state level and understand. And I know it sounds cliche. I feel like I had heard it before, but Titus and Jaylee's always saying your voice can make a difference, has just helped me open my eyes to all the places that was true professionally and personally that I wasn't seeing before. And just to give a brief example, some of you who are on the 9:30 call, I think 2 weeks ago, heard about Massachusetts being in process to renew its Title V federal funding. And this is a grant that funds home visiting programs and other programs that I've intersected with professionally. And so Titus and Jaylee said, please consider going to these focus groups because they want us to practice what we're learning. And I thought, okay, I'll go. And to my surprise, aside from the two professionals at DPH, Department of Public Health, it was Titus and I making up the focus group. And so there was a lot that I could share based on my experience working with children and families to answer their questions. And so I think really proving in real time through experimentation your voice is needed, your perspective is unique, you do have something to say. That's been helpful. And no matter where you are in your career, uh, at the beginning, at the middle, at the end, we all need that message. So I really appreciate that.
And I think if anyone who's ever planned a focus group or a meeting, right, you need people to come. So a focus group of one is an incredible experience for both of you. And just really want to appreciate that both of your reflections. Can you talk a little bit about how your experience is fitting in with your day-to-day work?
I can go.
Okay.
As a family childcare provider, and especially as a Spanish speaker, this has been an amazing opportunity to share what we are, what we represent. I was checking on some statistics. 60% of the family childcare license in Massachusetts are not English as the first language. So that means we don't know how many are Spanish speakers, but we need to call a unity and that everybody is on the same page, that everybody understands that we are appreciated, that we are loved, that we care, that you care. So it's crucial that we understand that as leaders, as a community advocate, is a natural extension of our work. And especially I want to take these opportunities this morning to share what Hispanics are. We are hard workers, loving your country and making our own. We are here as your great grandparents, parents came to seek a better future, to give the best. And I guarantee you, we are here to help. We're here to love. We're here for our families and for the ones that comes. We work for also the people that we left in our countries. In my case, I don't have any family member here, but now I have my new family, that is the Strategies for Children. It's a family childcare providers, and I want to reach out to every one of us that sometimes we feel afraid to talk because our accent is different, or we feel like we don't know everything. It's okay. Let's share our hearts, and that's the universal language, love. So I really love this opportunity to show up, to go to. We need to have these opportunities to have a multilingual service, and I really appreciate the work Amy is doing when you bring the different authorities and provide translation. I love that. We need to have the same communication and share our knowledge to everybody, and the same work that is doing Eco Latino. So I'm here to support what you are already doing and make it bigger and make it louder as a provider.
Thanks, Maribel. What about you, Amy?
Well, that was all very well said, Maribel. So the question I think was, I'm reminding myself, how has this made a difference in our work recently? And something I've been thinking a lot about. There is a lot of change at Mass General Brigham. I'm sure you all have heard, and our work is always a little bit uncertain, right? Like, will it be sustainable? For how long? And programs come and go. And we've watched that a lot in our broader community. And I think the fact that when you write something and it gets passed as a policy, it is sustainable for a longer period of time. It might not be funded, but it is a plan and a commitment to sustainability. So I think that's one thing I've been thinking a lot about, along with the internal changes that are happening at Mass General Brigham and Community Health. And then just another kind of moment of things connecting for me. I read this book called Whatever It Takes by Paul Tough, which is the story of the Harlem Children's Zone and how it started. And this was several years ago. And that was really what inspired me to take on this other role, more on the early childhood infrastructure side and reduce my clinical hours. And incidentally, the Chelsea Public Schools they launched about 3 years ago a children's cabinet where they get together a lot of internal stakeholders in the school and then community members. And I get to be a part of that now, which is really amazing. And the superintendent is also really inspired by the Harlem Children's Zone. And she took a delegation in February to Harlem to be part of the Learning Academy. And very strategically, she invited Senator Sal DiDomenico and Representative Judith Garcia, who cover Chelsea. And then we had a meeting, I think it was about 2 weeks ago on a Zoom, and we had these two elected representatives there, and they and others shared about the trip and what had meaning for them. And Senator Domenico spoke about how he and his chief of staff, Christy Ghetto-Young, who was also there and had just spoken to us 3 days prior at our monthly advocacy meeting, were so inspired learning about some policy in the state of Maryland that they started writing that night in their hotel policy that they're planning to propose to the state of
Wow.
Massachusetts. So I just couldn't believe, like on this Zoom where everybody's equal in a box, you have these elected representatives, you have Almi, the superintendent, saying, I didn't even know when I invited them to come on this trip with us what this outcome would be and the things that you cannot predict and the ways that you take a risk because you're moved by something or you're inspired by something and it comes together. So that was a powerful moment. And I know I saw it differently because of all the talking we had done in the cohort.
That's amazing. I mean, that's so true because I think having some information, having some knowledge, that where you are now sitting in that seat, we've talked a lot about bringing a chair to the table, getting to the table, but once you're at the table, you also need to think about, what are you going to bring to the table? How do you participate? Even if you're sitting there, sometimes it can be hard to connect and to participate. I'm going to give you a choice, either because it's 9:55. So either talk about an aha moment that you've had so far. And remember, the Advocacy Network is almost halfway, complete. We'll be done in August. And then what advice would you have for folks who are thinking about becoming advocates? So if you answer at least one, and then if we have time, we can go back. And I know, Maribel, you also have something that you want to share with folks about something that happened with you. So, Amy, let's go to you first. An aha moment, or what advice would you have for folks who are interested in advocating?
Yeah, I would definitely say to Jay Lisa's point at the beginning, consider submitting the simple application the next time it comes out for this opportunity. And then I'll share something that Senator DiDomenico's chief of staff shared with us that stuck with me, which was that on a given issue, they'll get 20 to 100 form letters. And I have been a part of sending those form letters, usually as part of the American Speech Language Hearing Association. But she said, the people who take the time to write your personal experience in that form letter, that's where they actually learn about the issue. And I never knew how that was received on the other side, like that form letter, how many.
Right.
So that's something I wanted to pass along today.
Thanks so much, Amy. Thanks so much for joining us. Maribel, I'll go to you.
So, what can I share about to be in here and to advocate? Please don't be afraid. Start sharing your story. Advocacy isn't just about knowing all the policy and how to make it. It's about making them personally and share your story, share your heart, get involved in the conversation, get a mentor, join in or our meetings, speak up. Small actions can lead to a big changes. I am very honored to be part of this. I want everybody to learn what a Hispana can do for you, what a Hispana is doing in America. And I'm very, very happy. And again, I want to thank all of you. I want to also thank ALX because they started Transform Your Childcare. We just graduated at UMass Boston, and I know Paula was one of the graduated too. And I want to congratulate everybody. This is something we all need. We all need training, support. We are afraid some funds are going to be cut. We need to care for everybody. We are the workforce of the workforce, so we need to care for us. We need all the hands together. Another thing that I'm really honored and happy is that I run a Hispanas Amigas group in Massachusetts, where I am getting everybody together and supporting each other, that we are not alone. Like I said, some of us don't have any family members, but it's okay. We're here. You have una amiga. I'm honored as well with the Empowering Leadership Latinas Award for this recognition of my work that is yours. This is, I want to dedicate to all of you that are in the field, putting your elbow, your hand, and your heart for our children and our future. So I'm very, very thankful and I appreciate this space and let's keep going.
Thank you so much. We have a minute, which is a long time in the 9:30 call. So I'm asking 9:30 callers, please send some love and appreciation in the chat. Maribel and Amy were the first ones to volunteer, or as Amy said, sign up last, so they had to go first, which is how life usually does work. And Amy and Maribel, what would you want policymakers to know? As Amy mentioned, we had Chrissy Ghetto-Young join us from Sal Di Domenico's office. To hear your story, Amy and Maribel, I know that you've also, you're coming to the directors meeting. What do you want policymakers to know? Not just about, the work that you're doing, but about the network, about kind of young children and families and what we need.
Yeah, I would love to jump in because, one thing that we talk a lot about is that the medical sector really reaches 98 to 99% of families with young children, either through prenatal care or pediatric care. And as we work to expand early education and care from infants to age 3 or age 5, I think we can be harnessing the medical sector so much more. And the pediatricians are telling us we can't do everything that families need when we see the families every 6 months or every 12 months. But there's not necessarily places to build these bridges between medical and community and early education and care. So I just wanted to put that out there because there are some programs that are doing that. But I'm hoping in this space, we continue to think about even the bridges within our own government between the education branch and the Department of Public Health, which, is a universal access point that currently exists. And we want to build that out in the early education and care space. So that's just something I'd like to lift up.
Great. And Maribel.
I want everybody to understand the work that family child care providers are doing. It doesn't matter if you're private or if you have a contract. We need to look for equity and support. The important to maintain the funds, especially with all the threats that we have right now with the federal government, and let everybody know that we are here caring for our future, and we are offering a quality care from our heart. I want everybody to understand the work that family child care providers are doing. This is more than a mom in a house. This is an educator, a professional, giving the heart to every child that comes to our home. So I want everybody to have a beautiful Monday. It's the last week stretch of March, a Women's Day. I want to appreciate all the women and the work that they are doing. And let's keep up. If you are a Hispanic speaker or no Spanish, you are welcome to join Hispanas Amigas in Facebook, Instagram. And I appreciate this time.
Wonderful. Well, there's lots of love and appreciation coming into the chat. Thank you to the 9:30 callers. And thank you, Amy and Maribel and Titus and Jaylees for joining us this morning. We're so excited to keep this going. As Titus said, we also blog about each of the Advocacy Network participants. And tomorrow we're going to hear from Tess McLean, who is the president and co-founder of Empower Children for Success. And she's going to talk about a bill that is aiming to remove barriers for family child care providers. Especially around zoning. And then Wednesday is sharing the mic. And then Thursday, we have our monthly visit from Aditi and Christy on the 9:30 call. So we will see you this week. Thank you so much for joining. Thank you so much for helping us celebrate last week. And have a great Monday. See you soon.
Thank you. Thank you so much for the opportunity.
Bye.
Thank you. Bye.